Welcome to Season 2 of the Pressbox. This is our opportunity to have conversations with you. I am Michelle Francis, your host for the evening. This evening, we take a look at where the territory is in the fight against the COVID-19 pandemic, our vaccinations, and our drive to reach herd immunity and achieve a new normal. Joining me for this conversation is VI Health Commissioner Justa Encarnacion and Dr. Esther Ellis, Territorial Epidemiologist. Both have been on the front lines of the territory's response since March 2020, when we announced the first COVID case in the territory. We begin with Dr. Ellis. Welcome.
Thank you. It's a pleasure to be here.
It's good to see you again. So we're going to start this evening with just getting a little bit of the lay of the land, where we are with vaccinations, how many people are impacted right now. If you want to jump into the stats for us.
Yeah, definitely. So as of today, May 27th, 2021, we have currently 120 active cases in the territory. 114,111 tests have been completed, and 3,442 of those tests have been positive. 110,669 tests have been negative, and 3,295 individuals have recovered. There have been 27 fatalities. And as of today, the positivity rate is 4.13%. And remember, we really do want to try to keep that number below 5. And so this sudden jump in numbers is very concerning.
Okay, we're going to jump into all of those things, but I'd like to talk first about an exciting breakthrough, which is the trial for teens. If you can give us a little background on that and what's available here in the territory.
Yeah, definitely. So overall, so far, when we think of and look at our vaccination rates, we've vaccinated a total first doses have been 40,406. And so that's 50.9% of our eligible population. And remember, young children can't get the vaccine, so our denominator isn't necessarily our population, but the eligible population. And those that have received a second dose or are fully vaccinated, so just one dose of the Janssen Johnson & Johnson, are 32,189. And that's 40.6% of the eligible population. The Pfizer-BioNTech vaccine was just approved, emergency use authorization for 12 to 16-year-olds. So previously we were vaccinating within the territory 16 and up. And so now 12 and up are eligible for the vaccine. And there were trials to look at the safety, but more so the effectiveness, because we already did know through previous trials that the vaccine was safe. But is it effective in children? Because children do have a very robust immune system already. And so part of the trials, there were individuals that were vaccinated, children, and children that were not vaccinated. And those that were not vaccinated, there were about 6% of those individuals did end up getting COVID. And so actually the results that are published, if you look it up, you can look up the Pfizer-BioNTech trials in children, was 100% efficacy, which is 100% protection in children. And that's wonderful. And a lot of people are, they might say, well, children, do they really need the vaccine? And yes, they do. There's a syndrome that you may or may not have heard of. It's called multi-inflammatory syndrome in children, MIS-C, and it can cause heart failure, organ failure. It can actually affect children long after they've recovered from COVID, and we really don't know what those long-term effects are on children. So it is very important for children to get the vaccine.
So just to recap, kids 12 and older can start receiving the vaccine. And it sounds like Pfizer and Johnson & Johnson have a vaccine that is being offered to kids right now in the territory.
So far, just the Pfizer, but the Janssen Johnson & Johnson vaccine and the Moderna vaccine are both undergoing trials. So probably soon we'll be able to administer that vaccine as well to children.
So my kids are too small to get the vaccine, but if I had a 12-year-old and a 15-year-old, my question would be, how safe is it and what are the side effects?
It is safe, and that has been shown through very robust trials. And as far as what are the side effects are very similar to what we're seeing in adults. Sore arm, a fever in children is a little bit more common than the side effect in adults. And part of the reason for that is because children have a much more strong a robust immune system. And so their response to the vaccine is a little bit stronger, which is also their, protects them even better because they do mount a good antibody response. And so they have really good protection after getting the vaccine.
Let's talk about the vaccine hesitancy here in the territory. I think you have some encouraging news about our seniors, but overall, we've talked about the vaccines that are available. We know there's an uptick in St. Thomas. So who's not getting vaccinated? And let's talk a little bit about what might be the hesitancy.
Most of our younger adults are the ones that are not getting vaccinated. So when we look at rates of vaccination by age, the 18 to 30-year-olds have the lowest percentage of them have gotten the vaccine. And as age increases, the percent vaccinated increases. Our 75 plus age group, almost 100% of that population has gotten vaccinated, which is wonderful. So it is, protecting our most vulnerable, but really we have not reached any level of herd immunity. So, if you're younger and you're thinking I'm healthy, so if I get COVID, I'll recover fine. It's not always the case. There are many young ones that do end up having to be on a ventilator, that do not survive COVID, and we have a effective, free vaccine that's available to everybody.
Well, if we have so many younger people in the 18 to 40 plus range not getting it, why don't we see more people in the hospital?
Because we've been doing such a good job at monoclonal antibody treatment. And so monoclonal antibody, bamlanivimab, it's one of the monoclonal antibodies, is almost 100% effective at preventing hospitalization if you receive the treatment prior to hospitalization. So far in the territory, only one individual that received the monoclonal antibody treatment did end up having to get hospitalized, but did quite well. Otherwise, it's prevented hospitalizations, which is great, but it's also a experimental treatment. And so it's much better to just get the vaccine than to get COVID.
And as a reminder, when people get the vaccine, are they getting any of the live virus?
No, they are not. So the Pfizer vaccine is actually designed against the spike protein of the virus. And so you mount antibodies that make it so that the virus can't enter your cells and make you sick. It's not live virus. It's a small sequence, a piece of the virus.
Okay. Now, are there plans for a booster? Are we going to need one? Can you talk a little bit about that?
So there is the idea of potentially needing a booster. At this point, there is no need for that, but as more people get COVID, there's more opportunity for the virus to mutate. It's called antigenic shift and antigenic drift. And every time the virus mutates, there's a chance that it mutates enough that the vaccine that we have taken isn't going to be protective. Or we might need a booster to kind of prime our immune system to mount a strong antibody response again. So far, we don't know when that will be, but as we've seen throughout the year and a half of this pandemic, we're learning. We're always learning, and we are always trying to stay a step ahead of the virus and being ready for whatever is needed.
Thank you so much. This has been excellent information. And on behalf of all Virgin Islanders, thank you for what you and Department of Health have been doing to protect us. Hearing about the treatments available here in the territory for those with COVID has been amazing. And so the message, what would be a final message for those who still haven't gotten vaccinated?
Please get vaccinated. I have a 5-year-old, and as soon as right now there's trials for the vaccine, 6 months to 11, as soon as it's approved, he's getting the vaccine. So I would vaccinate, and I will as soon as I can, my own child. It is safe. It is effective. It is the only way we're going to protect our community and really start to be able to open up and get back to some level of normal.
And that's the goal, getting back to normal. Dr. Ellis, I want to talk a little bit more about vaccine hesitancy, to just go into that in a little more detail. What is the data saying? What are some of the additional reasons people are citing other than age for not getting vaccinated?
Yeah, we have had the opportunity to do a lot of surveys in the community to understand those that haven't been vaccinated, why. they're not getting vaccinated. And the reason, if we understand that better, can we address those issues and hopefully encourage more individuals to get vaccinated. And so some of the reasons are it's an emergency use authorization, so some people feel like it was rushed. The amount of testing and trials that have been done, and also the millions of individuals that have received the vaccine, demonstrates that it is safe. And we do expect that soon it will no longer be under an emergency use authorization, but a full use authorization. So that may be able to address that group. There's some individuals that don't want to get the vaccine because they feel like there may be some long-term side effects of the vaccine. And I think we have to remember that vaccines have been around longer than I've been alive, and they are safe and effective, and they've been an incredible tool for public health to save millions of lives, especially when you go back thinking about the smallpox vaccine or some of our first vaccines that really stopped devastating diseases from completely wiping out communities. And some people in the community feel like maybe there's a conspiracy against, just the vaccine, or is it, that, so it's, do you trust your source? And so making sure we have trusted individuals in the community that can speak to their community members and speak to their experience with the vaccine and address any of those fears. I think those are some of the main reasons that we've heard from our trials or from our questionnaires.
And while the vaccine is new, the COVID-19 vaccine, research on mRNA has been going on for years. Can you talk a little bit about that? Like, is it 1 or 2 years, 10 years?
Yeah, I mean, research on mRNA has been going on since a very long time, since I was in school studying biology, microbiology. And you also have to remember, never has there been a time where this much amount of attention and funding has been available for the development of vaccines. So although it may have been fast, there were a lot of resources available to make it happen faster, so that individuals could get vaccinated safely to protect the health of people. And that's why it was fast, and it's good it was fast, so that we could get people protected and stop the amount of deaths that were happening. Because if you do remember,
the research had been done.
Right, exactly.
Let's talk a little more about herd immunity. It's kind of one of these catchphrases, but a lot of us, quite frankly, don't understand what that means, even here in the territory. So what is our goal? You had talked about it at the top of the segment, but if you can reiterate that and talk a little bit about herd immunity. Okay,
yeah. So herd immunity basically is when you have enough individuals in your community that are protected, that there's not enough non-protected individuals to pass it to others. So let's say you have a room of 100 people and 90 of those are vaccinated and 10 aren't. Because it's going to be that much harder for the virus to be able to find those 10 and infect those 10. The 10 are protected because of the 90. Wow. So it's kind of, then there's different levels of herd immunity required for different viruses. So even with chikungunya and Zika and dengue, we reach a level of herd immunity here, and that's why you don't see it for about 5 to 7 years. And then when everyone that was born since the outbreak, or anyone who moved here since the outbreak or didn't get it during that outbreak, it tips to no longer herd immunity and we have an outbreak. And so we have experience with that. With COVID, the estimate is 70% of the community needs to be vaccinated in order to provide some level of herd immunity.
And remind us, what is the goal in terms of the number of people we want to get vaccinations to?
Well, our goal by July 1st is 50,000 individuals, at least one dose. And we've kind of slowed down recently in individuals getting the vaccine. We have now we have the opportunity for 12 and up to get it. So we've had a lot of younger ones coming to get the vaccine. If you have a child and you're going to bring them to get vaccinated, just remember to bring your ID and their ID so that we can validate the age of the child as well as the permission of the parent. But it's we still have a ways to go. I think in the beginning I said, 50.9% in our population have received the eligible population 1 dose. About 40% are fully vaccinated.
Okay, excellent. So your message would be what in terms of vaccinations? What would you say to people today?
If you haven't gotten vaccinated, definitely please do. Even if you think you're healthy and you're going to recover fine from COVID, do it for your community. Yeah. Do it for your grandmother. Do it for your niece or your nephew or someone younger than 12 that can't get vaccinated, or someone that's immune compromised, or those in our community that have asthma or COPD, or individuals that have diabetes or cardiovascular disease, or anything that puts someone at higher risk to have severe disease. We have had 27 deaths in the community, and every single one of those deaths was hard for us, and it affected many people and families. And anything that we can do to prevent more deaths, I think I would just implore our community to if you haven't been vaccinated yet, to get vaccinated. And if you aren't quite sure why, feel free to call me or text me or email me. And I think my email will be posted in this presentation. And I'm happy to speak one-on-one with anyone about any concerns that someone has about the vaccine.
Thank you so much. And again, thank you for your efforts and the efforts of the Department of Health. So I've heard that the Department of Health has been meeting weekly with providers. What is that about? What has the result been? Can you talk a little bit about that?
Yeah, our partnership with the providers has been incredible. And so just a big thank you to all of the providers that are watching and participating in helping our community through COVID. But with the vaccine, a lot of our providers are partnering in receiving the vaccine, storing it properly, reporting out the temperature, because it does have to be, vaccines do have to be stored at specific temperatures, whether it's 4 degrees Celsius or minus 80 degrees Celsius, depending on the vaccine and how many days it can be at each temperature. So there's many, many monitoring systems in place. But the providers, that include our federally qualified healthcare centers, include the pharmacies, our private providers, many our Department of Health clinics, many partners have made this possible. And it's an opportunity really to hear from them what's working, what's not working, how the reporting's going, because in the very beginning, when we were first receiving these vaccines, there was a whole new reporting mechanism for how to report the vaccine that was given to each person to account for each vaccine received. And as you see, those numbers are very important too, because if we don't have a record of every single person vaccinated, regardless of where they were vaccinated, in one central database, we won't know when we've reached some sort of herd immunity, or we won't. Right now we're at 50.9%. We wouldn't be able to know that number accurately. And so that partnership with providers has been, with the vaccines, incredibly important for not just administration, receipt administration, but also data tracking.
And it sounds like you've gotten some frontline information from them. Has that helped you or informed the course Department of Health has taken in your messaging and your outreach?
Yes, and definitely understanding from the providers, because different providers serve different populations. What are they seeing in that population? What is the hesitancy that they need to address in various groups has been really critical to our targeted messaging.
All right, thank you.
Yep.
Hi, this is your Senator Samuel Carrion. I am proud to be a Virgin Islander working hard every day to serve you. Because here, we look out for each other. That's why I'm asking you to take Titi Carmen and your primo Jose to get the COVID vaccine. Some say they may ask too many questions. ¿De dónde viene? ¿Cómo llegaste aquí? But that's not true. Only your name, your age, and your phone number. That's it. No ID needed. Así que por favor, vayan a vacunarse para proteger a nuestra gente y a nuestra comunidad.
Hello, I'm Lorna Nichols, Public Relations with the Public Services Commission. I got vaccinated. There are many reasons to get your COVID-19 shot. The vaccine is important in slowing the spread of COVID-19. Now, once vaccinated, you can do some things that you didn't do because of the pandemic. Call the VI Department of Health, schedule yourself, and get the vaccine. Let's put a stop to COVID-19. Take your best shot against COVID-19. Get the vaccine.
Although wearing a mask, washing our hands, and social distancing has helped to slow the spread of COVID-19, it's not enough. To date, over 33 million people have been infected with the coronavirus. Over 500,000 have resulted in death, while the virus continues to spread. Up to 80% of those actively infected with the virus are asymptomatic. This means individuals without immunity can be carriers of the virus. They have the ability to spread the virus, but do not show symptoms of COVID-19. Now that you know, make sure you educate and vaccinate, because coronavirus does not discriminate. Take your best shot against COVID-19. Get the vaccine.
Hi, I'm Janelle, a 16-year-old junior at the St. Clair Educational Complex, home of the mighty Barracudas. I got my second COVID-19 vaccine shot, and I feel great. I'm encouraging my fellow high school scholars who are age 16 and older to join me and get vaccinated. I chose to get vaccinated to protect my family, friends, and of course, myself. I want to have fun this summer and be back in school this fall. I did my part to help end this pandemic, but it takes all of us. I took my best shot against COVID-19, and I encourage you to do the same.
Before we begin our conversation with Commissioner Encarnacion, we have a special clip. We had the honor and privilege of interviewing Dr. Marcela Nunez-Smith, one of our very own, who was handpicked by President Joseph Biden as the chair of his COVID-19 Health Equity Task Force. She also serves as his senior advisor on equity. Dr. Nunez-Smith joined us to discuss the task force's work to ensure underserved communities have full access to the COVID-19 vaccine. Let's take a look at the clip.
Dr. Marcela Nunez-Smith, on behalf of Albert Bryan Jr., our Governor of the United States Virgin Islands, and all Virgin Islanders, welcome. It is truly an honor and a pride to have you speak with us today. And we're going to go quickly into the questions. Discuss with us how the task force work will impact future policy on equity.
Great. No, thanks for that question. I mean, the task force is already hard at work developing recommendations to help inform President Biden's whole of government response to COVID-19 and also our recovery. So it's important, just for orientation, my honor to serve as chair of that task force. I'm also separately serving as senior advisor to the COVID-19 White House response team. But on the task force, we brought together folks from the federal administration, federal government, but also 12 people who are not part of U.S. government. And together they're working in subcommittees, generating those recommendations that will be delivered to the president once the work is done. So it is deep privilege. The commitment of the members is intense and genuine. And everybody's rolling up their sleeves, thinking about this unique opportunity to shape the future of policy for our country, including, of course, for our territories.
And I know that you've actually done so much work in reference to equity. From my research, you're actually known as the spokesperson or the person nationally who's known for work on equity. So that's wonderful. So when you speak about equity and you look at access, a lot of our individuals still have hesitancy towards a vaccine, even though now they're having actually a little bit more access. So give us some thoughts on that. What would you say in terms of the vaccine hesitancy for those that are Black, brown, Hispanic, or Latino in origin? What can we do? What would you say?
Yeah, absolutely. You nail it. I mean, here we are. We just passed 50% of all eligible adults in the United States getting vaccinated. That's a milestone. We're heading towards 70%, hopefully, of all adults in the country by July 4th. And that's great progress. Over 60% of people have received a shot. But we know that there are gaps there. There is a lot more work to do. And we know that in particular for Black, Brown, Indigenous communities, that we do see lower levels of vaccine uptake. And so access is the key word that you mentioned, because as people are deliberating about vaccine, we have to make sure they have access to good information, right? There is so much misinformation, disinformation out there. So they need good information from people they trust, number one.
There you go.
And from institutions that are trustworthy. And so that is really critical. And the messages need to speak to them. They have to resonate. They have to be tailored. So the work really, is on us to make sure people have the right information. And also to your point, it has to be easy. It has to be convenient. And so much of the shift in work for the federal administration in particular has been around making sure that vaccination venues are close by. People know it's free, no out-of-pocket cost to anybody for the vaccination. You don't need any kind of government-issued ID. You don't need proof of insurance. Making sure that things like transportation and childcare don't stand in the way, that people can get paid time off from their employer to get vaccinated, and if they need a day or two to recover, for that to be covered as well. So thinking about those structural barriers right along with making sure people have the information as folks deliberate. But you know what I always say to everybody is, when you get vaccinated, share your vaccine story. That's what people want to know, right? Why did you get vaccinated? What was your experience like? Some of the most persuasive voices are going to be the neighbor, the family member who says, look, you should get vaccinated. I did it. This is why. And look, I'm okay.
And share your comfort level, right?
That's
and
right.
You said trust.
Yeah.
And trust is one word that I think that we as Virgin Islanders really and truly are struggling with. And some people still are really hesitant with vaccine. What can you say to your community, to our Virgin Island community, to get them to listen a little bit more as to what we need to do to become vaccinated?
Yeah, absolutely. We are so fortunate to have these vaccines. They are millions, hundreds of millions of people have gotten them safely. They work, right? We already see in communities where people are getting vaccinated, the hospitalization, the cases are down, the deaths are down, right? So we know that they're working really well. We got to keep ourselves safe. We have to keep our community safe. It is our obligation to each other. What I say is, let's not take ourselves out of the opportunity to benefit from scientific discovery. That's really what it boils down to, is you get a lot of other folks who are saying, we recognize the vaccines are a key way out of the pandemic, and I'm signing up for mine. And we're just taking ourselves out of opportunity. Equity is about opportunity, right? That's what we started. Everybody has the opportunity to be well, to thrive, to achieve your potential. And so I don't want anybody getting sick. I don't want anybody dealing with long COVID, those debilitating symptoms that can last for who knows really how long. So much more work to be done to study that, right? And then to keep the other people safe around us who are more vulnerable. We have to do that.
Correct.
We are a community that loves each other. That's how we show
Good
our
for
love.
you. Thank you for saying that. And then look at the control that we have. The control in achieving herd immunity. So talk to us about herd immunity. What does it actually mean to achieve herd immunity, and what does it mean to us once it's actually achieved?
Yes, absolutely. And I know that's a term that's been around. And what I always say is, listen, we got to be focused on the people we're around. As we talk about these numbers and goals, I often say we're looking for, community immunity, because it doesn't matter if the average is 70%, right? And you live somewhere where the vaccination uptake is 30% and somebody lives somewhere where it's 90%. You all are living in different realities. So we want to make sure that as many people who can be vaccinated are vaccinated. That's how we prevent community spread. That's how we prevent the variants being formed. So, let me tell you, what I often say is, look, I understand people are tired, man. People are tired. COVID's been around a long time. But this is how we're going to reclaim our joy. When you get vaccinated in our own community, because that's what matters, who we hang out with. That's when you can go back to worshiping in person and feel safe about it. Gathering for sports events, for family reunions, right? This is the stuff, making sure our kids are safe in school, in person. So there is so much joy. The light is getting brighter. We got to hold the light, the hope, the optimism. But getting vaccinated really gets us closer to life as we know it.
So we need to become vaccinated as a community, so we can actually invite Dr. Nunez-Smith to come back home to FET with us, right?
Yes.
Isn't that the truth? Okay, okay. So we one of the things real quickly, in terms of the mutations, should we be concerned?
Yes, great question. So, first thing to know is that viruses will always mutate and change. That's what they do. So, we're not surprised by that. But some of the mutations might have clinical significance. So, might mean, it can transmit more easily or it can make you sicker. And we know all over the globe, this is a global pandemic. We have to be aware of these mutations or variants. What we do know is that all the evidence shows the vaccines work against the variants that are out there. So that is a great benefit, both in terms of knowing you're protecting yourself and your community, but also that you're preventing the spread and therefore preventing new variants, right? What the virus needs to mutate is a chance to spread. If you get vaccinated, you don't give it a chance to spread, it cannot mutate the bivariants. So we, at this moment right now, where we say, if you're still thinking about it, there is urgency here for precisely this reason. We have to get ahead of any potential new variants that could be more dangerous. So just to keep that in mind, but everything that we're seeing, no matter kind of where you've heard them coming from, the vaccines that are authorized for emergency use across the United States and the territories are showing high levels of efficacy against those variants.
Dr. Nunez-Smith, I want to thank you for sharing those words with us, for encouraging Virgin Islanders to go out and become vaccinated so we too can actually feel more comfortable and protect the ones that for some reason cannot be vaccinated. It was a pleasure, a joy, like I said before. Thank you so much.
Thank you. Everybody be well.
Commissioner Encarnacion, welcome.
Thank you.
Great to see you again. I know you've been busy, but it was amazing to see this special clip. Do you want to tell us a little bit about that?
Well, first of all, it's always good to be here and anywhere with you, Michelle. So I love the conversations that we have had in the past. And yes, it was definitely special. Dr. Nunez and I have actually never met. I should say Dr. Nunez-Smith. Dr. Nunez, who's her mother, and I have met because she was actually my teacher in nursing school, CVI, back in the day. So it was a very special moment for me to be able to ask her questions.
Wow. I know that you've been busy. We see you everywhere. We see you every week. We know we've watched, especially in St. Croix, our rates go down, but we've seen them spike. So I've got quite a few questions to run through with you. But I want to just hear a little bit more, and I think the community would like to hear about what you guys have been doing lately to get shots in arms.
Well, first things is, and we speak about vaccines, we speak about testing, we speak about communication. And so we were trying to figure out exactly who we need to target in coming in. Dr. Ellis spoke about, the age group, 18 to 30. So now we're focusing on the 18 to 30 age group. Okay. What is it that we need to capture their attention? First of all, that's also a very inquisitive age group. You know that. They want to know why. So let's tell them why. And I've always said, no matter what age you are, if you're unsure, ask the questions. If you are unsure that you want the vaccine, speak to us and tell us why, because we have the answers for you. We don't have all the answers, but they've done quite a bit of research at this point in time. So we have a lot of the answers, and a lot of the answers indicate that it's a safe vaccine.
Speaking to people's hesitancy, as Department of Health, the community is important in helping to achieve getting people vaccinated. So how have you been working with community organizations to work with the public to get them vaccinated?
Well, looking at the clip and speaking with Dr. Nunez-Smith, we spoke about community immunity. We spoke about trust. We spoke about influential trust. And so we've actually met with churchgoers. We've met with pastors. One of our last segments, we actually spoke with Lieutenant Governor, Dr. Tai Hansiza joined me, and we actually had several of the pastors, and we have actually collaborated with them. I've actually gone to churches and spoken to churches, Dr. Christensen as well. I have to say that Dr. Christian, one of our providers, have actually extended herself, and she's actually gone into communities as well. So we've done things like that. And we try to make ourselves accessible. One of the things that I think that nationwide, we're trying to make sure that we're not just sitting on a Teams meeting or on a phone call, but we're actually saying we'll come to you so that you can, one, better understand it, but two, actually get the vaccines because we're coming to you to give it to you. Getting the shots in the arms are important.
So we heard a little from Dr. Ellis about the stats, the numbers that we've got the 50,000 plus goal, and we're more than halfway there. We've got over 40,000 shots. So why is there continued COVID-19 testing, and who should be testing now?
Excellent questions. We still actually have, if we're looking at 50% of the eligible population receiving the first doses, 40% receiving the second doses, those are eligible populations. That means that there are individuals outside of that eligible population that can still contract COVID-19, true?
Okay, yes.
Okay, and so because of that, we want to make sure, well, there's another caveat to that, is that we travel quite a bit. Stay home, guys, stay home, right? Just stay home. But no, it's important for us to be able to travel. I just came back, from St. Louis. So there are reasons why you have to travel, okay? However, you still need to be safe and be careful. But it's not all the time that you think that you're okay, that you actually are. So you have to continue the testing for a couple of reasons: to detect and to curb transmission. And that's really and truly where Dr. Ellis and her teams come in. I mean, in terms of contact tracing, the minute we find that there's a positive, trust me, Dr. Ellis and her team is at work linking that positive person to whomever in the community he or she have been in contact with. That means we can then quarantine, we can isolate, and we can decrease transmission.
So it sounds like especially those who aren't vaccinated should continue to get tested if they think they've been exposed. And if you've traveled, you have to be able to show your COVID test results.
Correct. Now, one of the things is that, Dr. Ellis spoke about our active cases right now up to 120. We haven't been up to 120 in quite some time. Thank God, because of the amount of tests that we're actually conducting, our positivity rate is still below 5. We actually had a positivity rate 5.12, I think it was a couple of days ago. But right now it's still a little below 5. So those are all reasons why we want to make sure that we're testing, and we're testing the individuals we know that are more vulnerable. And that goes back to the age range of 18 to 30. We always go back, 18 to 30. And what happens when someone 18 to 30 becomes infected or affected by COVID? They then go home. They infect the ones that are even below 18, the ones that cannot be vaccinated. Then in turn, if your grandma, grandpa, auntie, uncle, mommy, daddy have not been vaccinated, they then become infected with COVID. They're the ones who now, Dr. Liz spoke to you about the monoclonal antibody. They're the ones now who have to actually receive the monoclonal antibody that is preventing increased number of hospitalizations.
And as she mentioned, if you're going to end up having to get this new treatment on the back end, might as well get the vaccine on the front end and prevent all of this.
And I have to tell you that Dr. Ty Hunt Caesar is the one who's actually managing that process. And from what she's saying, we actually have provided over 30 monoclonal antibodies to individuals within the community within a week. That's a tremendous amount. So we are blessed that we are able to receive it's called a medical countermeasure, just like the vaccines are. However, we prefer to give the vaccines and reduce the need to even give anyone monoclonal antibodies. And so we want to make sure that everyone knows that, yes, this is available, but if you receive the vaccine, the risk of you being hospitalized is still there. So a lot of people we prevent it, but let's say, for example, someone refuses monoclonal antibodies, that person may be hospitalized and our death rate may actually go up. And we don't want that to happen.
No, we don't. So considering the positivity rate and the rise in the territory, Let's talk about the new health guidelines that were released this week. Is it safe to ease restrictions on bars and, say, taxis given this rise?
I think that there are some restrictions that it's safe to reduce. There's some restrictions that we cannot reduce. Wearing masks is one of them. Hand sanitizing is another one. Social distancing, yes, at different times. So remember, the restriction goes to those that are vaccinated also. And so the sad thing is that not everyone is true to their word. So sometimes we see individuals out in the community or sitting in a bar or sitting in a restaurant who is communicating with others who actually have not been vaccinated. We can see individuals. We had a fete today. You know, we talk about having a fete, right? And I'll say this because I really want to honor Dr. Donna Christensen as well. But she is our health strategist, and she actually is going to be leaving, not health, she'll always be part of health, but she's going to be leaving that position in a while. And so we celebrated with her today, but we were able to do it in a safe manner. Yes, we had Mokujumbis, we had Stanley. We actually did dance, but we had masks on. We know we were vaccinated. And even though we knew we were vaccinated, we kept our mask on. So we can do it. We just have to do it safe. Let me go somewhere else. We have a lot of Virgin Islanders who actually go away to fete.
Yes.
Right? Okay, but when you go away to fete, you bring something else with you other than the fun that you've actually, and the good memories, you also bring COVID to the Virgin Islands. And so we're trying to get you to realize that just because you leave St. Croix, St. Thomas, St. John, Water Island, who have actually had very stringent restrictions, and you go away to the mainland and they don't have the restrictions that we have, and you decide to take your mask off and don't hand sanitize and fete anyway, and you have not been vaccinated, what happens? You bring COVID back home. So we really, really, really just want you to be cautious.
If you can reiterate for everyone, what are the vaccines that are available? So for those who haven't yet, we knew that Johnson & Johnson had recalled there. So where are we at? What is available to everyone?
All three vaccines are available. Pfizer right now is available from 12 to 18 and above. So from 12 to above. So that's definitely something that we have actually been presented to the community new. But Moderna is also available, not right now for the children. And Johnson, we've actually restarted that one. And that too, like Dr. Ellis said, they're going through EUA standards to see whether or not they can actually have the emergency authorization use.
Okay. So as a territory, we travel within the territory a lot for work. So I know I've heard when I'm in St. Thomas a lot of the cry still for cruise ships to come back.
Yes.
So let's talk about that a little bit and the prospects of opening up to cruise ships.
Okay. So we actually had a conversation with a cruise line this morning.
Okay.
So
wow.
You must have read my mind. You didn't even know that. Great question. And so we spoke a lot about requirements. Of course, the cruise ships, they come and they have their requirements. We have our requirements. And I have to tell you that we have actually set very high standards in the Virgin Islands. And I always say that we're able to do that because of who we have as our governor. Not because I'm his commissioner of health am I saying this. I say this all the time. He's a person who actually allows you to speak, allows you to think and to say exactly what you think. And we go back and forth, but it's important for health standards to be maintained.
Yes.
And he allows that to happen. So conversation with cruise lines are going to be like that. We are going to make sure that our health standards are sustained, because that's the only way that we'd be able to get out of the pandemic. That is our goal, to vaccinate as many people as possible, maintain community immunity or herd immunity, and be able to live a life that we were living once before or very close to. So yes, we will, and I've committed, we will see cruise lines coming back as early as